So what is a thigh lift? There's a couple different forms of thigh lifts that exist out there. Most of the time when we're referring to a thigh lift, we're referring to the inner thigh, so the interior part of your thigh. That's where most patients have difficulty with not only extra fat, but more importantly, excess skin. So if you have a combination of extra fat and excess skin, maybe you're a good candidate for a thigh lift. And so the incision typically starts somewhere down mid-thigh, all the way possibly even down to the knee, and goes up into the groin area. That will address all the excess skin of the interior part of the thigh. Now, there's also something called an outer thigh lift, and those incisions typically come up here at the waistline. So think about right around where your belt is. And with that, we're able to lift the outer part of the thigh. Now, there's even a third operation where we can directly address the outer thigh by making a direct cut, so down the length of your leg, or outer thigh that is, to address the excess skin there if you have a real robust amount of excess skin in the area. So during my thigh lifts, I like to add liposuction. I try to reduce some of the fat that exists throughout the thigh on top of removing the excess skin. I just think it ultimately gives a far better contour, result, and tightening of the leg.